Yeah. I always get emails from that random, girlfriend from high school that rejected me,
Yeah.
or something like that.
Yeah, popular right now, huh?
Yeah, yeah, awesome. Well, I'm glad our DM got through. I'm sure there's a lot in there, but let's watch a Kendall scene and see what he picked for this.
Changing room. Textbook ascending air cameras and 8 centimeters. 50% 1 year mortality. So he definitely needs surgery if he wants to live. Okay, well, he's a friend, so I will talk to him. I'll get him admitted to your service. Not today. Why not? He needs to see cardiology and pulmonary first to be cleared for the OR. They can do a stress echo, PFTs. He needs to be admitted and evaluated as an inpatient. Nothing ever gets done over a holiday weekend. He can take it easy at home. He's taking time on. He's probably been that way for years. We can get him early next week with a specialist, get his testing done. All goes well. He's on the OR schedule in a week. What happens if it ruptures before then? Call 911. Sorry, Robbie. Best we can do. Text me his number. I'll have my office coordinate.
Yeah.
Okay.
There probably gonna be some frustrating stuff, man. I always like to look at these like medical myths. Like I remember people say if you say the Q word. Like someone did a study on that. Like actually saying quiet doesn't make the ER busy. I actually looked up some studies for this as well. I saw a few of them. Like some of them dating all the way back to 2001, some in 2018. Even PubMed. I know you have a few things published on PubMed. There is something called like the weekend effect, where there is a slightly higher mortality on weekends. But there's like a lot of nuances on that because like they were saying like sometimes the patients are sicker. Sometimes there's less staff, and there are certain cases that have a higher mortality. Of course, like a dissection because the team's not in the hospital, they got 30 minutes or an hour to get there, so that can cause a few things. But when you mix in all the cases, there's not really much of a difference compared to weekend care versus like weekday care, I guess. Like we work in the ER, and so we're open 24/7, weekends, holidays, so you can get stuff done in the ER. But I did start to think that like sometimes we don't have ultrasound on the weekend, so we can get an ultrasound done, but it still takes about 30 to 45 minutes for the tech to get there to do it. So there's a little delay in care. So by him saying nothing gets done on the weekend, stuff gets done, maybe not as quick. If you do have an emergency, it's gonna get taken care of, but there can be a little bit of a lag. Of course, with like STEMIs, we call the STEMI team in on the weekend. They have, I think, less than 30 minutes to get there. So there can be some lags and stuff, though. But I get what he's saying. It's probably frustrating for Rob. You have a friend you're trying to help out, and like you got to send this guy home. And it's kind of nerve wracking, man. He said, what happens to a rupture? Call 911. It's kind of like, shit.
You're dead already at that
Yeah,
point. Yeah.
when they order dissection, man. 911 gets there, gets to the hospital. By the time the team gets there, then it's about an hour and a half process sometimes.
Yeah. Well, I think for me, it's like really, we talk about standard of care, right? And standard of care is like what, we all as a specialty, as a body of medicine agree on is what should happen. But it's not like black and white. And this situation's perfect, right? Like standard of care would be like, yeah, admit this patient, make sure they get all the tests, make sure they get the procedure so they don't need to call 911 so they're not bleeding out at home and, have a low chance of survival. But it's a gray area. There's a lot of gray area when it comes to standard of care, or even certain things like you learn in residency, like open fractures, they always, go to the OR for a washout. But a lot of times you'll send ortho a picture and they'll be like, oh, it's not big enough, just cover him with antibiotics. I'll see him in the clinic tomorrow. I'll see him, or even what he says here, it's like my office will call him and coordinate something. And you're like, well, I learned this one thing, but now the doc is telling me something else. And the standard of care isn't like as black and white as you learn in med school and then residency and out in the real world. It's interesting for sure. Ash, any thoughts on that?
I was curious, have you guys experienced that yet? The aortic dissection happening on a weekend?
Oh yeah, pretty sure in my career. I mean, I've had guys get. That's what I'm saying. If you're at home, I've had a guy drive himself there and get there, and he still didn't make it because we don't have cardiothoracic surgery at one of our hospitals, so it's a transfer out and follow the case up. By the time he got there, we flew him there. He coded there. I think with the life flight, and they got him down there, got him to the R and everything, but he just didn't to the OR. He just didn't like make it. So I'm saying these things are happen pretty quick though, depending on the rupture. It's like a small rupture, small leak maybe, but if it's like a total rupture, I mean, you're bleeding to your chest every heartbeat.
Yeah, and that's the unfortunate part too. Once again, standard of care. Like you could show up to a community hospital, they're not going to have a cardiothoracic surgeon or a vascular surgeon or various other specialties all the time. And so unfortunately, it's just something that people don't tell you. Obviously, you should call 911 and 911, the ambulance is going to know where to take you. But a lot of times people are like, oh, I'm just going to drive myself. And you happen to drive yourself to the hospital that's in the community and doesn't have those specialists. You just delayed your care by like 2 hours because they'll do their best to stabilize you, put you on a helicopter, but that's still, it's going to take hours to get to the OR. Whereas if you show up to like a level 1, medical center, trauma center, you could probably be in the OR in half an hour if, things get done appropriately and quickly. And so, yeah, it's just, and then we talk about rural healthcare, rural versus urban. It's even worse in rural settings where you have almost no specialties and almost everyone's getting transferred to the big cities. And if you have something like a dissection or a bad trauma out in the middle of nowhere, your chances are not that great.